Are we ready to go?
Yes.
All right. We will, good morning and welcome to the Tuesday, July 20, 2021 Urbandale City Council Lunch and Learn meeting. And I'll ask, we'll call the meeting to order. Ask Nicole to take roll call, please.
Carberry Montgomery. Here. Caduce.
Here.
Obrecht.
Here.
Russell.
Here.
And Hoagie is absent.
Thank you. Item 2, approve the agenda. Ask for a motion in a second.
So moved.
Motion by Obrecht.
Second.
Second by Caduce. Discussion, roll call.
Obrecht.
Yes.
Caduce.
Yes.
Russell.
Yes.
Carberry Montgomery.
Yes.
Thank you.
All right, that passes. Thank you. First item on the agenda is item 3.1, the fire department accreditation.
Thank you, Mr. Mayor, members of council. Good to be back at a lunch and learn meeting in person, always exciting. On the agenda tonight, this afternoon, this afternoon, as the mayor mentioned, is an update on the accreditation project, a process for the Urbandale Fire Department. You may recall that this has been mentioned a number of times during our budget review session, that the chief has just provided a very brief overview as to the process that they were engaged with when it came to, the accreditation of the fire department. Just as a quick overview, the police department has been accredited for a number of years, as has the Urbandale Library. So as the fire department proceeds with its accreditation process, and once it accomplishes that, we will have 3 of our departments that have reached accreditation status, which I think is quite an accomplishment. So with that, I would turn it over to Chief Jerry Holt for an overview and update on the accreditation process.
Chief, I did not turn that mic on yet. If you could just push the button down at the bottom. Thank you.
Can you hear me now? Great, Mayor, members of council, thanks for having me. With me is also Assistant Chief Scott Lyon, who is the accreditation manager. So if there's a question that I can't answer, hopefully he'll be able to answer that for you. But I know 3 of y'all haven't had the background on accreditation that the rest of you have had over the years, because this has been an ongoing process. So I just want to take a quick opportunity to share some stuff with you about accreditation. We're proud to be part of it. As AJ mentioned, there's only a handful of departments that have both fire and police accredited in the same cities nationwide. In fact, there's only like 300 cities that have accredited fire departments. And when you look at fire and police, it's even a smaller number than that. So it's quite an accomplishment. So I just want to go over some things with you real quick. So we'll spend the next 4 hours talking about this. Hopefully we'll get through this in 15 or 20 minutes really quick for you. But just want to let you know who's responsible for accreditation. The Center for Public Safety Excellence is who the accreditation is awarded through. They offer all kinds of training for us and all kinds of assistance to help us become accredited. But outside that, and the bigger thing is they help us look at the things that they're going to be evaluating, and that's best practices. What are the best practices for a fire department? And obviously the best practices for a fire department of 3 stations is not necessarily the same best practices for a fire department that has 22 stations. So there's some scale of the community. So it's community driven. What does the community want? And I've often said it's not necessarily what the fire chief wants, it's what the community wants. What level of protection does the community want to have? And then we look at things on a risk basis. So we try to find things that we can identify identify as a risk. Like for us, and a quick example would be the number 1 reason we have EMS calls is because people fall. So then what can we do to address that risk to reduce the number of falls and thus make it safer to live in our community? So we do risk-based assessments. And I tell you that because it's not all about fire. Even though it's the fire department, fire is a small part of what we do, and EMS is about 82% of what we do. So we have an opportunity to impact some things there. And it's also performance-based. Not only what you say you're going to do, but how well do you do what you said you were going to do. That's one of the things that they're going to be looking at. But I put this slide together because I think it's a better representation of what accreditation is all about. It's about the money that you allocate for fire and EMS. What do we do with it, and what are the outcomes from that investment? Improved patient care, professionalism, lower insurance premiums, lower fire losses, and then best practices. Again, it's all about the money you put in and what you get out of it. And we are extremely grateful that our council's been so supportive of our efforts over the years. You've invested a lot of money. In fact, I would say you probably have invested more money in the fire department than any other department in the city in the last several years, adding staff to get to the point that we are. So what is the organizational performance things that we look at for accreditation? Well, the first thing we have to do is to complete a standards of cover document. We did that in 2017. You may remember that. Most people, when they go through the accreditation process, they do that and then immediately go into accreditation and pursue that at that point. We did it a little bit different in our effort to achieve accreditation, in that we created a standards of cover document, and we started addressing the things that were identified in that standards of cover document, the things that were opportunities for recommendations for improvement. And then we started looking at how we could measure outcomes. So we've been measuring our outcomes way before 2017, but in 2017, when we got this document, we were able to more focus on the things that were identified in the standards of cover document. You'll see in there 94 core competencies that are evaluated, and that addresses 154 performance indicators. So it's pretty complex on what we do in looking at that performance. Here's the areas of evaluation that goes into accreditation: government and administration. And you say, well, that's pretty straightforward, but you'd be surprised how many fire departments don't even have a code where they've been lawfully established as a fire department to do that. Of course, that's an easy thing for us because it was already all in place. Assessment and planning, goals and objectives, financial resources, again, you guys have provided that. Community risk reduction, which has been a change for our department, going from looking at nothing but fire prevention to bigger and how can we improve the community safety as a whole, not just fire. Physical resources, which you've invested a ton of money in that, building a new fire station, and we'll see some numbers on that. With human resources, training, essential resources, external relationships, health and safety, all things that we have been working on for a long period of time. In fact, I would tell you, I came to Urbandale in February 1998, and one of my first goals was to achieve accreditation. I was the first professional fire chief that they had, first career fire chief that they had, and it didn't take me long to figure out that was not going to be achievable for some period of time. But we started working on this from that time forward, so it's been a long time coming. How did we get here? Again, a strategic planning process. We had developed a strategic plan years ago. In fact, that was one of the first things I did all the way back in 1998, is develop a strategic plan. And we have updated it over the years, and the council adopted our strategic plan some time ago, right after they adopted the standards of cover document. After you did that, we went forward and became a registered agency with the Center for Public Safety Excellence. That basically gives us the ability to get some resources to help steer us in the right direction. And then in July of this year, we've seen in the budget, we had the funding to move to the next stage, which is an applicant agency. During the applicant agency period is when we start really putting the rubber to the road, so to speak, and putting out a lot of the things that the visiting team is going to want to see when they visit here. Visit a group of our peers that will come from other departments and visit with us. And we will be producing those things here shortly. One of the things that changed while we were going through that is when we started this process, it was the 9th edition of accreditation. We've now moved to the 10th edition in the process. So we had started a lot of our stuff in the 9th edition. Now we're going to have to change that over to the 10th edition, but we don't foresee that being a big issue. Once we become an applicant status, again, we have to get all of our documents and complete that process by March of 2022. It should be 2022, because our goal is to achieve accreditation in August of 2022 at the National Fire Chiefs Conference, which will be the time that we'll go in before the commission to make our case. We should know way before then if it's positive or not. Basically, when they come and do a site survey, they look at all of our fire stations, they look at the city, they look at all the documents, and they look at all the data that says, here's what we said, we have response times of 90%, we do it in this. They'll want to see that, and they'll want to see the data to make sure nobody's cooking the books, so to speak. And then once they finish their site visit, they will recommend that we either proceed to a commission hearing, which is what we're shooting for in 2022, March of 2022, defer that for 1 year or deny that. And I can tell you that we believe nothing more than we'll proceed to the commission hearing to go to the next stage. Once you become accredited, you're accredited for a 5-year term. Each year there are things you have to meet and have to supply. So this is what it's all about. It's continuous quality improvement. Achieving accreditation is not an end game. It's kind of just another step along the march to continue to get better. And again, I'm happy to say our department has been marching that way for some time, trying to get better. So if we went back to our standards of cover document, we looked at all the data for 3 years before that. So it would have been in 2016, 2015, and 2014. And then we identified those things we wanted to prove in that standards of cover document to get better during that period. And I would tell you that was a tough period in our time because we didn't have enough staff to do the things that we needed to do, and we didn't have stations located where they needed to be located. So it wasn't hard to do some easy improvements with the investments that you guys were putting into the department. For example, one of the goals was 90% of our incidents, we should have first apparatus arrive within 8 minutes, 90% of the time. And basically, accreditation looks at everything from a 90% of the time standpoint versus average. So I can tell you we have an average response time of 5 minutes and 36 seconds. And that's great until it took us 8 minutes to get to your house. But when we use the 90 percentile, we can say that 90% of our calls occur within this time frame. We will never get 100% because there's always outliers. And I live in one of those neighborhoods that's an outlier. I live north of the interstate, and it's just physically hard to get to that location. So it's not going to be in the 90 percentile most of the time. But it's certainly something you can identify and then address. In the case of where I live, you could say, well, what fixes that? Well, a different station location fixes that. But it doesn't make sense because there's not enough houses in that area to make putting a fire station up there for such a small area economically feasible. But if you look at our numbers from 2018, 2019, and 2020, each one of these bars represent Station 41, Station 42, and Station 43. Even though we had no Station 43 before 2020, we still had that district built into our system. So anytime there was a call in that area, we're still measuring the time. They're just not coming from physically Station 43. They were probably coming from Station 42. But you can see a dramatic improvement in all across the board when we opened the station in 2020. We're now meeting that 90% of the time, 93% of the time in each one of those stations areas. So that is an awesome improvement.
Now with closest unit response, Jerry, how do you track that?
We track that as well. So if a call occurs today, right now, if a call occurred at Perkins, we would still measure the response time for that call, even though Clive's going to handle that call. So we're still measuring that we're meeting those requirements.
Got it. Thank you.
But significant improvement from 65% to today at 93%. And I think you're going to see even some other numbers that are even better. For all emergency fire suppression incidents, making sure we have enough emergency response force or the number of people that arrive on scene to be able to do something. So you can say, well, I can arrive in the chief's car and it only takes me 5 minutes, but as one person, what am I going to do until a fire truck gets there? So our numbers we've established is we need 14 people on scene to be able to do all the tasks to start the process. That's certainly not the end of the process, but to get us going. And you can see from 2018, we weren't meeting that at any station, to today, 93% of the time in 41 and 94% of the time in Station 42 and Station 43 area. We're getting that many personnel on time in that percentage. So that's an outstanding improvement. For EMS incidents, you can again see where we've made some improvements. Again, in Station 41 and 42's territories basically stayed the same, but you can see that Station 43, bringing that online, took us from 57% in 2018 all the way to 99% in 20. So a marked improvement. And really all we've done is we've cut out the travel times. So if somebody had to come from Station 42 to drive out to the farthest west portion of 43, it's physics. It's going to take X amount of time to get there. And building the new station, we've cut that part out so we can get there a little bit quicker. So a significant improvement there. And again, I mean, I think this is so valuable to show the investment that the city's made and what you've gotten for it. And back from the fire one, I can tell you that we've had 3 structure fires in 43's territory in about the last 6 months. And in each one of those was a positive outcome. Now, don't get me wrong, significant fire damage to all of those homes, but it was a fraction of what it would have been if we'd had to come from 42 and 41 back in the day. Marked improvement. One of those was actually in a Clive address, but it was covered by Urbandale because it's in the northwest territory of Clive where we have designed to cover.
So Chief, so you track it separately, EMS calls from fire calls?
That's correct.
And EMS calls are 99%?
Correct.
Because there's less apparatus to get there?
No, still the same number of apparatus. Generally, we send a fire truck and an ambulance to an EMS call, unless it's at a physician's clinic or something like that, then we only send an ambulance. So still the same number of apparatus responding, but they're just responding from a much closer location. Does that make sense?
Okay. And so you track the fire calls as differently than EMS calls?
It's actually tracked exactly the same. So if I have chest pain, we're going to look and see what time did it take for them to get there for the chest pain. If I had a chimney fire, we're looking at the same data, that how long did it take them to get there, a fire truck and an ambulance, okay? In 2020, 7 minutes and 18 seconds, 90% of the time, which is the best we've had to provide ALS or advanced life support, making sure we get somebody there quickly. And one of the things that we've always struggled with is turnout time, and it's really one of the things from a volunteer standpoint that is the toughest hurdle to overcome. Turnout time is the time from it takes that you get alerted to a call to the time the truck starts out the door. So back in the volunteer days or paid on call days, that starts with their pager going off. Then they have to go to the fire station, pick up an ambulance or a fire truck, and then physically respond to the call. That would take anywhere from 4 to 8 minutes for the person to get the call and then get to the fire station. Imagine if you were at your house, it's 2 o'clock in the morning, you got to wake up, go to the fire station, pick it up, then go to the call. So over the years, when we've added staff, we brought that number down significantly, and our goal is 90 seconds from the time that we're alerted to the time that the truck response is started. And you can see in 2018, it was 118 seconds. Today, or in 2020, it's 92 seconds. And that's for emergency calls. So we don't really measure some of the non-emergency stuff. We provide a lot of non-emergent services. In fact, if we don't believe it's an emergency, we think it's easier to go without lights and sirens than to have lights and sirens and disrupt everything. So, if somebody fell out of the bed and they need help getting back in the bed, we don't send lights and sirens to that. We just send the people to that. So a little different response.
Thanks for clarifying that, because I'd always wondered, I was in fire station, I was in 42 talking to Chief Lyon the other day, and the guys just rolled out, but there was no siren. So that would have been that type of a call.
Right. So,
Okay.
so we do a large percentage of our calls in that mode.
All right.
And, it may not be that you as the patient, you may believe it's an emergency, but it may not fit the criteria that Westcom is using to ask these questions to decide if it's a life-threatening emergency. So if we're out back playing ball and I break my finger, well, it's an emergency to me, but it's not one that I need to run lights and sirens to pick you up and endanger the public along the way, because it's not going to change the outcome of that broken finger. If you're not breathing, lights and siren, we need to get there as fast as we possibly can, because you're going to die without that.
So you're not including those non-emergency calls in the data that we're seeing?
Not in this numbers, no.
Okay.
But we can provide that for you.
Oh, no.
We have it.
No.
And one of the ironic things to me, and I was just talking to somebody about this earlier today, is that it's generally just a matter of seconds in the difference between emergency and non-emergency responses. So you don't pick up as much time as one might think, because we don't have long responses. Urbandale's not, 60 miles across, where it's going to take you a long time to get there. So when we measured them on average, we were showing about 30 seconds difference. And in some months, it would actually be 2 or 3 seconds quicker non-emergent than it was emergent. So it just depends. But another investment that you guys made over the years was in preemption control. So we can turn the red light green so we can get through it a little quicker. Because if it's red, when we get there, we're going to stop, whether we got lights and sirens on or not. Because when you came here today, I guarantee you didn't go through a green light and check the other way to see if somebody was coming, because you assumed you had the right of way. Nothing worse than having an ambulance or a fire truck blow through a red light because you weren't expecting it to happen and take you out. I mean, it unfortunately happens in our nation way too much, but it's all about risk. As I went back to the risk, some of the risk is what we do. We try to reduce that risk by not responding lights and sirens when we can. So getting the number of people that I mentioned before on scene, we met that goal in 2020, 100% of the time. And again, that's not all just our people. So we measured the Clive engine that's coming or whatever mutual aid resources is coming. Doesn't have to be all Urbandale people there. We just got to have 14 people, that minimum number. And the Clive fire that we had on the 4th of July is a great example of that, because it was northwest area of Clive. So you had an Urbandale station, you had West Des Moines, you had Waukee. So collectively, we had those numbers, but it wasn't just any one department that was providing 100% of the staffing.
Was that the fireworks?
It was not fireworks. That was a house fire.
Okay.
The fireworks that you were thinking of, probably about 9,400 on Hickman.
Yeah.
That was on the 6th, and that would be a different number. But again, Clive and Urbandale response to that one. One of the other goals that were identified in the standards of coverage was to do the drop boundary, and we were already in the process of doing that, and that's the closest unit response. So we initiated that, and you can see the numbers there. It's about 600 to 730 per year that we do that each of us are covering for the other. And again, that has gone remarkably well. I've never had anybody say, well, that was a Clive patch, I want an Urbandale patch. They just want somebody trained. They want a big red truck to show up if it's something that they need the fire department for. They don't care what's on the side of it. And that's probably our greatest success, because there's so many places that does not work so well, especially if you go out east, where if the last house on City A is in their boundaries on fire, you don't call City B till City A gets there and decides they need City B, and then it's only begrudgingly that they call City B. And we're past all those turf battles, so that we do what's best, and that has really gone well for us. So another goal we identified in the standards of coverage document was we needed a new third station. We already knew that. One of the big things that the standards of coverage document helped us with was where we were going to put that. And basically, the city had some property at 170th and Waterford Road, which is a little bit too far out west to be able to achieve the numbers that we've been able to achieve. So bringing it back a little bit to the city-owned property at the Parks and Rec area, right there at 152nd, worked out well. Of course, you all know that it's a collaboration with Clive. They're paying for some of the staffing. In return, we're covering a lot of their area. You can see the improvements there. And now customers in that area are getting service with 8 minutes, 99% of the time, which is our goal, 8 minutes, 90% of the time. So we're exceeding our goal. Some of the other things that are still out there that we haven't addressed, the first one's a Battalion Chief. One of those things that the standards of coverage document identified was we need to have one person that's responding to any major calls, not having to come from home, that's on duty, just like the fire department is. And one of the neat things about that is that's a shared issue. Clive has the same issue. So whenever we get to address that issue, the cost should be split with Clive and Urbandale. And in the document, it talks about splitting that cost 50-50. So we'd pay for 1.5 positions, they pay for 1.5 position, and that one battalion chief then covers all 4 of our fire stations seamlessly, so that they're taking care of the day-to-day stuff. 2 of the other ones that we have not addressed, the first one's an alternate response unit, and that would be if we could identify that we have 90% of our EMS calls are from 8 o'clock to 5 o'clock, then it would make sense to upstaff during that time period. but ours aren't that dramatic. They're more split out amongst the day. Certainly, most of them are from 11 o'clock at night to 7 o'clock in the morning. There's not as many calls overnight as there any other time, but not enough that you can say, well, we can take stuff out of service because you still got to have it if the need does arise. But that was one of the recommendations they said to look at. The other one I would love to get into someday, and that's community paramedicine. And there's a carrot for the fire department in doing community paramedicine. It's only when you partner with the hospitals, because hospitals get penalized when a patient is released from the hospital and readmitted within 30 days. So when that happens, then some of their reimbursement gets significantly decreased. So community paramedicine is aimed at preventing people from going back into the hospital. So a patient that may have been discharged with congestive heart failure, if we're monitoring their blood pressure and checking on them on a daily basis, then we can probably keep them from going back to the hospital when a week later they've continued to deteriorate instead of staying steady, and because somebody was taking care of them. Nationwide, that's a really big trend. It's also an expensive trend for the fire department. And tying it back to keeping the patient out of the hospital is the difficult part. So I got to be able to show you, hospital CEO, that I'm saving you money so that you pay me money to save you money. And that's not always an easy sell. But I do think that's the future of certainly bigger cities where they have so much abuse of the EMS system. And this also keeps people from going to the emergency room when they don't need to go to the emergency room. How does that benefit us? It benefits all of us. So then it doesn't cost, $10,000 to go to the ER visit, because when somebody goes and they don't need to go, they still got to do all the tests and stuff on a patient that probably shouldn't have went to the ER to start with. So that's something that may be down the road, difficult one. Some of the other things resources that you have available to you, if you've looked on the Urbandale website, if you go underneath the fire department, there's a couple things there that could be valuable to you. The first thing is that we do a customer survey. Typically, when we get somebody injured and we have somebody on light duty, we send a customer service survey to all the patients that we've had in a 3-month period, so we can get some feedback on that. We haven't had anybody to do that in a while, but we have instituted where they can do that survey online. So we put that on all their bills, so they have an opportunity to go online and tell us how we did. Basically, we just ask 5 questions. Did we respond quickly? Did we act professionally? Did we take care of the issue? Those type of things. The other 2 pictures that you see here are also available on that Urbandale website, and that's a performance dashboard. And this is just 2 things that you can see from that performance dashboard. The picture on the right shows the number of incidences where they occurred in the heat map. So you can say, well, I wonder how much calls are in this area or that area. And typically that's done on a quarter basis. So you start the quarter, it's going to be a small number. By the end of the quarter, that number is going to grow. But we can share that data with you from any time frame you would like to see. If you'd like to see, what's it look like over 2 years or a 3-year or 4-year period, we can show you all that. But it's set up to do quarterly. As a visitor to the site today would look at it, you're going to see quarterly. You'll also see the picture on the left shows the gauges that show how we're doing on those response times and different measurements that we have there. I think we have 4 that are stock on this website, but we can provide you any of that data you'd like to see. So if you say, I want to know this, we can get that data out. This is part of our performance management dashboard that we've paid for sometimes through council funding to make sure that it's easier for us to get the data we need and be able to share it with accreditation to show, here's what we say, here's what we do. So that's it in a nutshell. I'll be more than happy to answer any questions that you might have.
Are you going to have the Citizens Fire Academy again?
2022, that's the plan.
Publicize
I was
that.
contacted today, so we didn't have it last year, obviously, or the year before, so we plan to have it again in 2022. Fingers crossed that our numbers don't go up and we are in a position that we can do that, but we're planning on it at this point.
I know the mayor and I have both been through it. I highly recommend it. It really gives the citizen the overview of what's going on, how your department works, and it's well worth the time.
And we appreciate that. We've always felt like it was our opportunity for citizens to see what do I get for my money? How do they do this? What do they do? And what's all goes into it? So that's kind of how we've tried to build it is, here's what we get, here's what we do with what we have. So, yeah.
It's hard to swing your leg over a building with full gear on, though, I learned that.
So it's, it can be challenging.
Yeah, I learned what it takes to do something in full gear, that's for sure.
I think this is really good information, especially as a resident of the District 43. I would really love us to put this information out in a digestible way to really show the public. I mean, we've been online for over a year there, but I think we are looking at doing another bond referendum, yes, for a totally different subject, but I think showing the community that we are very good stewards of their resources when it comes to these significant bond referendums. I think the data really shows how much adding Station 43 has improved time throughout the community. So I'd love to see us tell the story. Looking at Derek.
We have the annual report out. You put that out on your site, right?
Right, it's on our site. We put that out typically in January or February, but we can certainly do something that's a 1-page or 2-page,
Yeah.
small snippets that are, here's where we were, here's where we are, type stuff that,
Yeah.
here's what we've gotten for that investment.
Because I think going to, what is it, 99% on the EMS calls from 7, I don't know, it was a huge increase.
Dramatic improvement, yeah.
There for the Station 43. And then just kind of a random question. Someone told me that we are the station, the Urbandale is the first unit response for the Clive Aquatic Center. Is that true?
Yes, that would be in an area that we'd be first response to.
Okay. Do we do any extra training with the facility there?
We haven't done anything with them. When our pool was up and running, we did a ton of
Yeah.
stuff with our pool, but we haven't really done much with them. It is our expectation that they're out of the water with the lifeguards by the time that we arrive. Anything less than that is not going to be very much of a positive outcome. You're going to take the time that it takes us to get there, but still should be within 8 minutes to that location. So, yeah, still have a chance, but we haven't done that. So that's a good point. Maybe that's something we need to look at doing.
One thing you mentioned and I was going to ask it, but you mentioned that the insurance, it was generally lower when you have ISO compliance. What in a real typical, for a typical household, what's the impact of that, Jerry? I mean,
It really depends. It depends on the insurance company because the insurance company doesn't have to use ISO.
Yeah.
But the history for us, just real quickly, is when I was hired, we were ISO Class 5. I was notified the first week of my job that ISO is going to be here next week. I'm like, oh no. We went from an ISO 5 to an ISO 6, and I'm like, the higher the number, the worse it is. I'm like, great, they hired the first chief, and the first thing I do, we go from a 5 to a 6. But we are now down to a Class 2. And probably that's probably all we'll be able to get to. As you look at the other numbers, it's hard to get to a 1 unless you just add such an extraordinary number of staff. So the insurance company doesn't have to use that rate, but they can. We find some that do, and the savings depends on the insurance company.
Okay.
So one may save you $100 a year, and the other one may save you $500 a year, so it just really depends. But significant improvement. Our partners in Clive just received their newest one, and they're a Class 3. So there's only a handful of Class 2s in Iowa, and even nationwide, it's something to be proud of. My goal was to get to a 1, but it just doesn't seem practical.
But the point is, though, it's a real savings for our taxpayers as a result of this, what you're doing for the accreditation and the compliance. So.
Absolutely, and ISO and accreditation are tied together, so you can use some of the stuff that we do for ISO as part of our accreditation process, and at the end of the day, the consumer needs to say, we're an ISO 2, how about changing my rates to an ISO 2 if you're still paying for an ISO 5, which was several years ago? Right. It's up to the consumer to do that. When we achieved an ISO Class 2, we reached out to all the insurance providers in the area and informed them that we are now ISO Class 2. So we made an effort to make sure that the persons that were spending the money were getting some return on that investment.
Right.
You mentioned adding the battalion chief as an item. With the accreditation process is like replacement of equipment and some of those, maybe increase the cycle that we've been on, so the resources are gonna go up a little bit too, resources needed?
You know, it would depend on which one you would be specifically talking about. So let's say a ladder truck, if you said, I want to replace that instead of every 20 years, every 25 years. I don't know what's been identified as the best practice for that. We'd have to take a look at that and see. I know that what we have is typically our fire apparatus are 20 years, our ambulances are 8 years. But outside of best practices, the new ambulances that we'll be looking at, the next 2 that will be replaced, are going to be significant, most likely will be more significantly expensive than the last ones, because we're having to go from a type 2 ambulance, which is what we have today. You see that with a van front and a box on the back, to a type 1, which is a pickup truck front and the same box on the back. What gets you to have to move that is the gross vehicle weight. And we are at the point now where we've maxed out our type 2 ambulances, and when it's time to replace, probably going to need to go to a type 1. So we've budgeted for that new expense. But also, I think part of that is getting that extra heavy-duty unit to allow you to do that is the potential to use it longer than instead of staying on that same 8-year replacement schedule. So outside of what they recommend, we're always looking at those items as well.
And then the individual's gear as well?
Yes, so gear has to be replaced every 10 years is what the standard is. I would say a lot of ours doesn't make it to 10 years, but that's, my gear will make it 10 years plus, because I don't get to do a lot of the fun stuff. I have to stay outside. But some of the other people that are doing it more often, sometimes we have to replace their gear a little bit quicker. Very expensive investment though, because a set of gear is about $2,500.
We have to redefine your sense of fun, Jerry.
Well, I think he has plenty of fun.
Yeah, so when you do the Citizens Academy, you'll get to see what some of that fun is, and I think a lot of people's like, yeah, that is fun. So repelling, not everybody gets that, but not everybody has to do that either. So,
Chief, are there any standards related to equity issues, diversity issues in these standards?
you know, I don't know if there are. I know it's an area we've been working on. We have hired 2 females in our department as full-time firefighters. We have some Bosnian employees, but we don't have a lot of representation outside of that. But it's something that every time we do recruitments, we really try to work on.
And then, I appreciate that answer, but then anything related to working with the public or your interactions with the community?
Yes, there's a ton of information in there about that, and that goes all the way back to our strategic planning process. Part of that is engaging the public. But I will tell you, that's been a difficult endeavor the time that I've been here. So we put it out and maybe 1 or 2 people show up, and typically it's people like you that have an interest and some people from the community. But we really haven't gotten a lot on that. So we continue to work hard in that area to improve those every time we do it, by putting it out on Facebook, by doing all that stuff to try to get people involved. And we will continue to do that. Maybe that means that we do forums a little different in the future, that we go and do it at a park area and see if we can get people to meet us that way if they won't come to the fire station. But we're looking for those opportunities to get people involved, because this is about what the public thinks that they should have. And I see my role as the fire chief saying, here's what we have, here's what you could have, here's what you could cut back to, what direction do we establish that we want to go? And then the public, and then that we bring that to you, and then you decide what direction that we move with that. So it's a constant battle to get people involved with that.
I will say there was a long line for ambulance tours at the 4th of July when I was up there. So your team was doing a really nice job getting them through the ambulance and doing those kinds of things, so.
Well, thanks.
I don't know, that was you were probably the most popular ride.
But, you know, we try to take advantage of those opportunities when we have them. So we still do birthday visits and some of those other things to get people educated. So when we do a birthday visit, it's not just so Johnny can see the fire truck. We're trying to talk fire safety. We're trying to let the public see this is the investment that you've made, and this is what you have in return for that. We'll always get those people that are like, well, you shouldn't be out of the station unless you're on a call. And it's like, birthday visits are win-wins. Win for the person that's requested, and it's a win for the fire department because we're driving territory. when we're going to 123 Smith Street, that's just like we're going to 123 Smith Street for a fire. So we're making sure we learn our territories. While they're there, they're supposed to be looking at where the fire hydrants are, where those things are located. So it's a win-win that not everybody gets to see.
I just saw on social media where people were commenting positively about, you were just training at Valeria's, I think, recently, right? You're using.
Yeah, and so we take advantage of everything. So this week, we're down there doing active shooter trainings with the police department. So God forbid we ever have to deal with that, we'll be a little bit better. And we did the same thing when they tore Olmsted down. Before they did that, we just don't have a lot of opportunities to do a large structure like that.
Yep.
People generally frown on you coming in their business and doing that kind of training. So.
Little disruptive.
Now, you still, your department still does the fire battery replacements?
detectors?
Yeah, smoke
Yep,
detectors.
that's a great tie-in. I should have made this point, and I know I'm running a little bit late, but just quickly, when somebody asks us to do a battery replacement, that goes back to what's our number one reason for calls is falls. So the more we keep people off ladders, so we're helping them put their smoke detector in, they get that done. We
There you
kept
go,
some people
AJ,
off a
remember
ladder.
that.
Typically, it's our older population that takes advantage of that, but occasionally it'll be somebody young as well. But the more we keep them off the ladder, the safer we feel like we're being.
And how many of those calls do you do a year? Or do you keep track of that type? How many
We do track it. I don't have it off the top of my head, but it's, more than 150 a year.
Yeah, see, and I'm not sure everybody knows that the fire department will come out to your home and check your smoke detectors and put batteries in it for you to keep you off of a ladder so you don't fall.
Why did you look at me for the old
Well,
All right,
If
well,
you have any more questions, y'all feel free to email me. I'd be happy to get back to you and get that information.
Chief,
for you.
thank you very much. That's
Thank you.
very informative. Thank you. Good job. All right, we are going to move on. We do have a full agenda, so we're going to move on to item 3.2, and that is a update on the Urbandale Food Pantry. And then Patty Stedden-King, our Executive Director for the Food Pantries here. Patty, the floor is yours.
Hi, Mayor, council members. Thank you for giving me a moment just to update you on the happenings at the Urbandale Food Pantry. I will try and talk a little fast. I know we're over a little bit on time. All of you received some documents just about our year in review and our annual report for 2020. And of course, what an unprecedented year everybody kind of had trying to navigate the pandemic and making sure people had access to food. A couple just points that I'd like to make is that we doubled our efforts in food recovery in 2020. In 2018, we rescued about 150,000 pounds of food, and in 2020, almost 300,000 pounds of food was rescued in partnership with the box stores and connections that we have in the community. Because we have such a robust food recovery program, we did expand into Suite 36. So thank you to the city for supporting that endeavor and adding on to the location that we currently have, creating a delivery option. Oh, hi. Creating delivery options for our senior population, homebound individuals, or anyone that just didn't feel comfortable coming out of their home during that time. Partnering with United Way to provide transportation to the pantry for individuals who had transportation barriers. As we navigated, there was a lot of ups and downs that we see in our numbers, which usually can be tied to whether families were receiving a stimulus package, kids being in school, being out of school. And so one of the things that we're doing now as we're kind of heading out of some of that is to really get a mindset of some of our families that we serve and what is the best way to communicate with them and to reach to them. So is that by our Facebook? Is it website? Is it, creating some type of an email system or text messaging? And making sure that they are utilizing their community resources and the resources that we have and using some of that funding that they get for their basic needs like rent, utilities, and some of those items. At the end of the month, this month, it is highly likely that the emergency proclamation will end. What that also does will stop food stamps at the max allotment being available to all of our families. So over the course of the last 18 months, a family that receives food stamps has been able to receive the max allotment that their household without having income factored in. At the end of the month, that will now start happening. So there will be a reduction in families in the amount that they will be getting. So we look at some of those trends and see, is that going to affect our families? Is it going to increase the number of families we're serving? And so really making sure that those benefits that they are receiving are used for other basic needs areas. And then just really encouraging them to utilize their community resources. One of the new things that we're doing that starts this week actually is in partnership with Healthy America and DMARC is we are providing families with produce boxes every week for the next 12 weeks. It's up to 50 servings of fresh vegetables and fruits that families can come pick up. One of the efforts that we're doing with this is to try and increase healthier food options, having more access to fresh produce, and a variety of other things. And so DMARC is the only organization in the state of Iowa that was selected for us to partner with them in this program. So we're very excited. 500 families can sign up for the program. I can tell you I've signed up about 150 of them. So a lot of families that we serve are going to be able to benefit from this program.
Patty, do you get donations from the Master Gardeners yet?
Yes, we do.
Okay.
So one of the things in conjunction with that 300,000 pounds of food is we also, and I don't have the number with me, I apologize, track what of that is fresh produce from the Master Gardeners, community gardens, and gardens around Urbandale. It is such a blessing to have those available for our families, to have that extra fresh produce and all of that available. The difference between checking into our pantry, which is once every calendar month, versus the Anytime room, which you can access every day that we're open. No ID is required, no check-in is required. And so families, I know people who stop by every single day just to see what's available, if they can grab some stuff for the day. There's sometimes milk available. There's always produce, bread, prepackaged options. Mondays and Wednesdays, our families know that we do food rescue from Whole Foods, so there's typically a line at the door. And for some odd reason, everybody knows on Tuesday we get KFC, and I get phone calls every Tuesday for KFC. But, so it's unique, but, and so, as we've kind of navigated this pandemic, we have been very fortunate, and it's been really awe-inspiring, the collaboration and the support from the community and people reaching out to really make sure that people have access to food and access more often. Pre-pandemic, our board of directors and staff participated in a strategic planning session, and one of the things that was identified was facilities. Of course, insert pandemic, all of our priorities kind of took a back seat as we navigated, and so we've now been able to kind of re-engage some of those priorities and start making some forward motion on what that looks like in the future. In meeting with the city a couple weeks ago, recognizing that right now there's currently no location that kind of meets those minimum requirements of being east of 86th Street on a bus line with adequate parking and a loading dock of some sort of receiving area. And so I know they did a fantastic job of creating a project in your system as properties become available to try and see if something would work for us. So there's that avenue that we're taking, and then also working with ISG to do some space modeling of our current facility to see if there's a way that we can best optimize our current space. As we have grown, we've just kind of fit things together. It's all been piece by piece. It's never really fit the needs of the pantry. So are there things that we can do to kind of minimally optimize our current space that can tide us over as we continue to look for a different location or what the best way to move forward is going to be? And just looking at, as we continue to grow, increasing those policies and procedures that we have, which has been really fantastic. If you look on the year in review, we on average see over 400 seniors a month. We on average 1 in every 3 individuals that we serve as a youth. So one of the unique things that the pandemic did was really brought food insecurity to the forefront of everybody's mind, and hopefully, I hope, shifted a little bit of a narrative on who accesses food and the types of families and individuals who are needing assistance. We, on average, were checking in 60 plus brand new families every single month who had never received services before. And so those numbers are continuing to happen. Checked in a new family this morning. Every day we're welcoming new families to the pantry. As we continue to see, and the number and data show, the effects of the pandemic, especially in food insecurity, will be longstanding. And so how do we best fit the families and make sure that we're reaching, the pockets of individuals that we're missing. So in working with DMARC, and we can do an overlay on data for the pockets of Urbandale that have the highest percentage of poverty and who are not utilizing the food pantry. So I'm doing an every door direct mailer in 3 different languages to get sent out to make sure that families know, come and see us, we have these resources available. So I'm hoping that's something that can just make sure people know that we're here to help them and to assist them. Again, really trying to focus on community mindsets and letting people know that we're here. We also know through data and information that the Latino population is probably the hardest hit population and demographic of the pandemic, whether it's lack of access to funding and supports. And so we really want to make sure that we are making ourselves available to everybody that needs access to food. I think that is all I really wanted to update you guys on. We do have our event coming up at the end of August that the mayor is going to be joining us again, called Powder for the Pantry. But we really appreciate all of the support that you guys have given us and continue to look forward to partnering in the future.
All right, thank you, Patty. I know I was just talking to AJ as you were talking here a little bit. I know we've been trying to get coordinated with, when you talk about a facility and trying to coordinate some discussions with UCAN as well and try to, to look at that as far as maybe a potential to do that. I think that's still a very real possibility, and we'd like to.
Yeah, we've been kind of looking at what does that wish list look like and trying to figure out what we can do for a combined location and what best benefits everybody. I think the unique challenge that brings up is UCAN is Urbandale residents only. The food pantry is a border-free food pantry. So there definitely has to be some conversation on how do we make that work and function in a co-location, but anything's possible in meeting with Laura, so. Yep.
Our goal is to make sure everybody's covered, but, but we have an efficient use of what services are needed too. So I appreciate everything the food pantry is doing. You're doing a great job. And especially during the pandemic, as I witnessed some of that, it was made it very difficult, but you have a great core of volunteers, I think.
We do.
There as well, and so.
We are very fortunate to have some amazing volunteers, and especially we probably pre-pandemic had about 170 very dedicated volunteers, and that scaled back to probably about 70 that were working multiple shifts, multiple times, a day, that really reached out. There was a lot of volunteers. Our average age of a volunteer is 65 years of age or older, so many respectfully stepped back for obvious reasons where they just didn't feel comfortable being in the setting that we had. And so our board members stepped in. There were members and staff from the city that came over to help us schlep, is what I like to call it. There's a lot of schlepping when you have 8,000 pounds of food coming in and you offload it off a truck, put it onto dollies, and then put it, so a lot of schlepping. And so we really appreciate the partnership there, and some of the staff from the city that come over, help us unload, and then come into work. And so there's, our volunteers are absolutely fantastic in partnering with the Hanson Company, who provided our intake booth to really make sure that our families could have a conversation with us. We could make sure that we were meeting their needs, asking if they needed any additional, and providing the privacy. Before that, it was kind of like playing a game of charades on what they wanted, what we had, point to a thing. So I'm glad we were able to streamline our process. And actually, we just started welcoming families back into the pantry a week and a half ago. So really focusing on, we're a choice pantry, and we're a choice pantry because there are so many benefits to families by being able to come in and pick out their own food, whether it's dignity, having a sense of control over what they're picking out for their family. It also decreases waste. We're not giving them food that they don't want or that they're not going to use. So we've modified our distribution again, and so families now have the option of the pre-pack if they don't feel comfortable coming in, or they can now come back in and shop for their items.
I just wanted to give you guys a shout out for all the food rescue work that you're doing. I know it is a community-wide effort. I was just at the Waukee Food Pantry yesterday morning dropping off some stuff that came in from our food drive at church, and I know that you guys are there every Monday picking up, at least every Monday, that's the days that I go, but picking up the stuff that Waukee is getting from Costco. And I know that it's all, I mean, you all work together. Adele was there, Urbandale had your truck there, and I know you share with when you have an abundance. So I think that really needs to be recognized, that the goal of the food rescue is to make sure that this good quality, fresh, for the most part, food, produce, meat is not going to waste. And I just love that no one agency is taking more than they need. So
Melissa at Waukee is fantastic, and it's really unique to see the collaborative effort between all of the pantries. You know, Urbandale Hy-Vee called me and said, I've got 50 boxes with 12 per case of fresh chickens. I'm either throwing them away or they're yours. And I'm like, well, one, I don't have the space for that many boxes and that many pounds of chicken, but please don't throw them away. So I figured it out, got a couple pantries there. We were able to get all of it. I don't want to be the highest pantry with numbers and the amount, I like to share as much as possible because, yes, we have an amazing community support. For example, we're doing food rescue from Starbucks, but it's the Jordan Creek Westtown Parkway. So I offered it to Melissa over at Waukee, or the one in Clive. We shouldn't pick up from the Clive one, let Clive Food Pantry pick up there. So spreading that to make sure anywhere a family goes can have access to some of that. Our pantry is unique in the fact that we budget and fundraise and receive donations to purchase milk, eggs, diapers, formula, personal hygiene items. So we do see a larger number of families that come and utilize the pantry because we believe that those products are vital. If you are at the store and you think about all of the non-food items you put in your cart, none of those can be purchased with food stamps, and most of them tend to be a little bit more expensive to purchase. So having access to that is crucial for a lot of our families. We're also open on Saturdays and late till 6:30, so we see a lot of working families as well. And so we do see a lot of families that go out of their way to come to the Urbandale Food Pantry, but I want to make sure that no matter where they go, they can still have access to some of those things.
All right. Great.
I tried to be fast.
Thank you, Patty. Appreciate it. We'll keep the discussion going. All right. We will move on then to the next item on the agenda. That's the downtown Urbandale update. AJ, I'll turn it over to you for that.
Mr. Mayor, members of council, thank you. I'll be a brief introductory comments, and then I'll turn it over to Aaron DeYoung, our Assistant Economic Development Director, who along with Curtis Brown, the Assistant City Manager, Economic Development Director, have worked really very diligently over the last several months, pushing this item forward. If you'll recall, this has been highlighted through your strategic planning process. And obviously what we experienced in 2020 through the pandemic and all the uncertainty that came out of that, the periodic shutdowns of various industries' activities, and again, as we worked through that and kind of hit that pause button, as things started getting better, we took our finger off the pause button and started working toward that strategic goal of the council. Because it has so many different components to it, and that it's just not, for example, a physical rehabilitation. There is a number of other issues associated with that is incorporated in your strategic plan that we said this is elevated from a staff perspective to one of our highest priorities to try to resurrect off of that pause button into the activity button. And we were very fortunate that we have connected with some other partners that are making that happen. Obviously, as you know, that the activity associated with the Myrtle Hay Mall, again, pre-pandemic with the housing opportunities that were created there. And then as we went into the redevelopment opportunities involving the Des Moines Buccaneers, their association and partnership with the mall certainly was probably more of the marquee activity that people not only in our community but throughout the metro focused on, and that has taken a number of positive steps, again, from a staff perspective due to the work of Curtis and Aaron. But at the same time, it really is, if you look at the bigger picture of redevelopment opportunities, it is one piece, but a very important piece of that project. And so, it looks at revitalization, it looks at blight remediation, reinventing or reintroducing economic opportunities. And so there are just so many things that are moving parts of that. So again, I just wanted to kind of kick that off with some of the introductory comments, letting you know that from my office's perspective, which incorporates the economic development as well, this has really generated into one of our higher priorities. Again, even during the pandemic, we were planning to moving that forward, and as again, things eased up, it gave us an opportunity to really start in earnest with that. But with that, I would like to turn over the rest of the presentation to Aaron to overview. I know we have some time issues. If we go a little longer, please bear with us, but we certainly can what we don't cover today, based on your time, we can come back and discuss with council, because there are things coming before you in the future that will be linked to these activities as well. So with that, Aaron, please.
Great, thanks AJ. Mayor and Council, happy to be in front of you today to talk about the updates, and really want to use this as an update, actions to date, as well as our intended next steps to talk about it moving forward. This presentation, I get to do it, but it also is it's a three-person lift here with Curtis Brown, as well as Steele Harder, our economic development intern. He helped us out with this presentation, in particular the maps. So his good work on there has really helped us out. Looking at downtown Urbandale, folks always kind of know what it is, but they don't know where it is or what we're really talking about. And so this map in front of you is the area centered around 70th and Douglas, with the mall there on the eastern portion of the Douglas corridor. And then 75th Street is the furthest west of that dashed yellow line. And it's dashed because we don't want to make a hard and fast rule as to what downtown Urbandale is, but definitely when we're looking through the comprehensive plan and analyzing this focus area, we need to look at the commercial corridors, but also its interaction with the adjoining neighborhoods. So that's why you see the kind of the definition going all the way up to Aurora and all the way south to Roseland, so that we can incorporate the commercial corridors flowing into the neighborhoods that are there in the area. Also, to kind of get your bearings for the area, here is the zoning map in front of you. The green, which is most of it, is our R1, so our single-family residential district. The light blue is our neighborhood commercial zoning, which I kind of eloquently call our quietest commercial zoning. It's the least impact from adjoining neighborhoods uses in that. So like no live music, no heavy retail uses allowed in that corridor, in that zoning. And then the general commercial at the mall properties. The PUD zoning is the TWG zoning. It's a weird shape file there on the yellow, but it has shrunk down to just the TWG parcel. And then R3, our multifamily zoning there right next to it. So we don't want to use this time to talk too much about Merle Hay, because that's not really the focus, but it certainly is an adjoining project that is providing a catalytic type of reaction here for the Douglas Avenue corridor. And so in June, we were happy to be pre-awarded a $26.5 million allocation for the Iowa Reinvestment Act. That's $3.5 million short of what we ultimately requested. And so we are working right now on filling that gap in doing that with our partners, with the Des Moines Buccaneers and with Merle Hay Mall. All the work up before that was, kind of figuring out, hey, what do we want to do? What do we want to commit or to have this project be? When you get the money, like, okay, now we got to make all that reality. And so we're in right now on site design at the Merle Hay, incorporating the site requirements, the building plans, the Buccaneers are working on that, and then getting the financial design. So we say we're going to have private financing. We probably should have a loan commitment letter that's into our final application and things like that. So a lot of heavy lifts are going on right now. It always seems slower than what you want it to be. But we are moving forward with all of those components. Des Moines is also going to be looking at the master plan for the mall corridor, which is a requirement of the mall's development agreement with the city of Des Moines, and that'll be going to their planning review board in August. Looking more to the Urbandale side, staff has met, and we are working with the the architects and the consultants that the Bucks have on the zoning and the site plan documents, and we are all shooting to have that come to you in the October timeframe. So that's what we're shooting for. It may not happen, but we've laid out the game plan for that to be achievable. And then with that, we want our IRA final application to get the absolute commitment from the state on their assistance right around that same time frame. So either before or just after the zoning and site plan approvals are approved. Then after that would be the IRA bond issuance, because we would have the commitments, then we could be able to go out to the market and sell those to assist with the construction, which we are all shooting for November 2021 for the build back to occur. Before that, the Bucks are hoping to do some of the demolition work prior to, so that when it comes November and the approvals are done, that they can go right into the next construction phase to build back what was demolished. Des Moines is also working, yep.
Are we still on track with that schedule? And was it Michael, the Bucks person? He was talking about the puck dropping would be.
Yes, that's why
that's
why the end of October is what we're shooting for, so that construction, if we get those approvals then and construction can start in November, then yes, it's about a 10 to 11 month construction schedule, assuming everything goes as planned, but construction world is a little weird right now. It's totally achievable if they can be in the ground in November for the fall 22 season to be in the new facility.
Thank you.
Yep. No more questions on Merle Ham Hall? No, I'm joking.
I'm just so excited.
Yeah, no, it's exciting. And it's, like I mentioned earlier, it's a catalytic type of feel for the whole corridor. And so it's important for these two things to be linked together. Des Moines is thinking about their part of the Douglas Avenue corridor as well. And they did a master plan last year and are starting to implement that with the restriping of Douglas Avenue from its very eastern portion all the way to the city boundary, or to Merle Hay, excuse me. And closest to us, they are restriping the 4-lane corridor to a 3-lane with a continuous left lane, and to free up ultimately more real estate for multimodal uses in that corridor. So I'm sure there will be lumps along the way that folks will get through that. I've already seen some of them on Nextdoor, but it's a great test case to see if the volumes along Douglas can handle that type of thing and can be a canary in the coal mine for Urbandale's consideration of something similar. With Merle Hay kind of being a wind in our sails for the Douglas in downtown Urbandale, folks are noticing that and feeling that wind in the sails. And some recent transactions have occurred that are showing that folks are getting more bullish of this area. Starting from east to west, these red parcels are ones that have recently transacted. The TWG is the furthest on the east, there at the mall campus, and then working further west, Plaza Flores and the old gas station parcels on the north side of the road were purchased by Dan Stambro. And then working further west, that's the Cornerstone Gymnastics parcels. Jeffrey Jorgensen sold those parcels, what he owned there, to Jeff Stambro, and that is earlier this year. And then recently, the operators of Stormy's purchased the lots that Colby Interests owned in that area as well. Working further east, in early 2020, the retail center just west of Walgreens transacted, so that's another indication. And then lastly, the Dana companies are going to be going into the old dry cleaners building when that renovation gets done. So in not a lot of area, quite a few transactions have happened. And through talking with them and others, that it's people believe that there's a better day coming for this area. And so it's not only talking about it, but actually people plunking down investment dollars is even a better sign of we're possibly on the right track. So with those conversations with property owners, with businesses in the area, overall, people are generally excited about the mall improvements and what that could be for the corridor. But right after they say that, they say, but Douglas isn't that great. The sidewalks are crumbling. Things need to be done. There hasn't been a lot of investment here from the city for a while. So there are certain concerns about that. They're worried about the further decline. If things don't get moving in a different direction, that is just going to continue to erode. But overall, everyone sees a positive momentum. But some are uncomfortable to act, invest, or see what is going on. But others, through transactions, are showing that a better day is to come. What we really wanted to use this time with all of you for is to kind of figure out an early vision for downtown. We know we have a comprehensive plan coming up. We know Merle Hay Mall is going to be seeing a transition. But we also, with the economic development plan, kind of being the marketers with the development community, we kind of need to know or get some early feedback from you as to, are we on the right track for what this area is to become, or what people should be thinking about when seeing properties. So looking at these four big kind of bullet points that we have here is first and foremost having Merle Hay Mall be that catalyst, to have that entertainment and sports destination be plopped into this corridor. We think that is something that we should build upon and then kind of link everything together. And then looking at Douglas, people are talking about, we want Douglas to be a place where people can walk. We want it to be a place where the businesses see it as an asset rather than a liability or just a busy road that cars whiz by. And so encouraging pedestrian uses is kind of feeling what folks and what property owners see that this area to be. Third is to connect Merle Hay Mall with Douglas. If someone tried to walk from the old Yonkers to Douglas, they'd feel like they shouldn't be. And I think that needs to change, and others feel that needs to change. But that's something that needs to be evaluated and talked about through this whole vision, through the focus area planning, through the comprehensive plan. And then lastly, going back to some of the parcels, these are all very small parcels that are going. Assemblages need to happen to make big things happen with the city's regulations on parking and site plans and stormwater and detention and all that kind of stuff. But folks feel that this should be a place where somebody just gets to there and then enjoys it. It kind of points towards a park once type of, excuse me, a park once type of environment. So that you drive, you get the kids in the area, and then on to the opening up doors and things like that. These are all kind of things that other successful kind of downtown areas, that I'm using that loosely, but you think about the Ingersoll area, you think about Valley Junction, you think about Beaverdale, you think about Prairie Trail. Those are all kind of areas that are all unique, but all kind of have these similar type of feels and things that you expect when you go there. And if those are some of the other things we want to get a discussion on that, and we can do that at the end of the presentation. But certainly there are things that need to be addressed to make those things a reality, should that be the vision. One of them is the zoning. I mentioned earlier it's a low impact commercial zoning, and things that people really want to go to and do those other things aren't really necessarily low impact. The site requirements are another thing, so trying to get on small lots, the parking you have to do, the detention you have to do, and then still have enough leasable area on that parcel to actually make it cash flow are all things that need to be considered throughout this process. Douglas Avenue is a 4-lane without a turn lane. It's 35 miles an hour, and I don't know if I even go 35 miles on there. It's usually on the high side. So roadway design, as well as the infrastructure, be it sidewalks, bike trails, spots where the bus could go should fixed line go through there.
Is Des Moines putting in bike lanes on their redesign for Douglas?
I don't know if it's through the striping that they're going to do it. I don't know if they striped there. I haven't been down on the east side of Merle Hay to see if they striped for bike lanes or not. But the intent is to have a beyond curb 10-footer, similar to our Complete Streets design. through that part of the corridor. You can see that on this one here, that the left side is the wider
Yep.
thing there. And then lastly, these are all things that would be great, but money is always an issue and always an opportunity to get creative. And so we need to think about, what do we want this area to be? And then ultimately, how do we crack that nut and get it done? So to wrap it up, kind of the next steps, the big next steps to keep in your mind and to keep in our mind as we are moving forward through this is that comprehensive plan. The RFP is out, it's on the streets, so that's a great thing. Downtown is one of the focus areas on that, so really a deeper dive into this area to kind of lay out that playbook and to affirm it through the process, because ultimately it has to be approved by the city council, this comprehensive plan, and really lays out that case and what the community wants in that area. And then we can gear up the financing, gear up the financial assistance to make that a reality through its implementation. And then lastly, the Merle Mall approvals will be coming to you, starting in August with Des Moines Planning Review Board on their master plan, and then following right with that will be the rezoning to a PUD for the mall on Urbandale, as well as the site plan to do all of that. That'll be coming to you in October with that. So that ends my presentation. We do want to have discussion on kind of those vision things to make sure that when we're talking with property owners, with businesses in that area, that we're not going out on a limb, we're not out in front of you on what is kind of to be in the future for this downtown Urbandale and the eastern part of the Douglas corridor, Urbandale's Main Street. So that ends my presentation. I'll pull up that slide on the vision things, and Mayor, it's over to you.
All right. Thank you, Aaron.
I guess my question is more on timing of stuff. Are we being too slow by letting the comprehensive plan drive the process?
We would love to have the playbook as soon as we can have it, so that certainty can be provided to the development community while they're making decisions. That isn't the case right now. Through the comprehensive plan, there's always the potential that you could do a focus area earlier on in the process, so you can kind of, let's talk about these certain areas and then fold it into the larger comprehensive plan document. You could also have the argument of, well, we should do the full community vision and then do the small area plans. Downtown Urbandale's got some momentum right now, so I would prefer the prior rather than the latter.
Right.
So that folks can make decisions and we can start having really, really serious conversations about how we can make it all work and get some revitalization along Douglas.
Yeah, from my standpoint, I like the visioning piece of getting there, being the park once, including higher density residential in the process. I don't know, and then that means that lots have to get assembled for that type of thing to happen, I think. Parking in behind, thinking block deep, not just Douglas frontage only.
Yep.
And we've had those conversations. I think that's part of this process and hope to see it continue, but maybe this is the first piece of the comprehensive plan that gets completed sooner than anything else, hopefully. Because I think going back to your map of all of the parcels that have sold, and I think at least 2 or 3 others are for sale in that area as well, there's going to be a lot of transactions and money spent before there's a plan. And like with the Dana Company, is that the highest best use for that parcel? Well, they've decided it is right now, but it may not be what we want it to be in the end because it is such a small lot. So hopefully we can get there sooner rather than later.
Yep. Yep. Real estate's it's worth what you could do with it.
Yep.
And if you're thinking about changing what it can be used for is certainly, makes the calculus different.
Is it customary to hire, and folks know where my position is on consultants, but are there companies out here that, you can just say, hey, look, we come up with a master plan on what could be possible? Bridget, I know you work like in the Highland Park area, and that was kind of a comprehensive plan of everything from 2nd Avenue all the way down to the 6th Avenue, and beyond that whole corridor was transformed. is that something that does happen in this type of a situation? Where we look at bringing on somebody and say, hey, draw us or give us some ideas on what can be done, number one. And number two, how do we go about acquiring or moving these pieces around? Do we go to a current owner and say, look, if you move off of your location, but we'll relocate your business across the street in a strip center? Or I'm thinking, for example, Christian Photo. If you went to Brian and you went to Dick and said, we know you want to still stay in business, so how about if we were to build a strip mall across the street at the House of Hunan, for example, and then you would move Christian Photo over there, you'd still be in downtown, and in return for that, you are going to go ahead and sell your parcel or swap it or somehow, and then that frees up that corner that we can move things back and forth. Are there consultants or companies that do that? And is that something we thought about?
Yes, and hopefully they all apply for our comprehensive plan to be able to do it.
Okay.
Yeah, it's, through this revisioning, it's creating, what you want to be and look like through, like Councilman Orberg said, like the density. How will that look? How will that feel through, 3D renderings, through, corridor analysis to see how that works? And then, talking about moving one business to another, I mean, that's sometimes where the real estate community accepts their risk and earns their reward through that process and trying to make those things happen. And then certainly the city plays a role in redevelopment efforts. So we would be interested in helping out however we can to achieve the accepted and approved vision through the comprehensive plan. So.
Just to answer back what Councilmember Obrecht made a comment about, and I made this comment earlier in the presentation, is that with the comprehensive plan, we did accelerate that based on what some earlier projections were coming out of the pandemic or during the pandemic. So as mentioned, the RFP has hit the street, hit it last week. This will be the main focus as far as when the selection is made, is that this is the highest priority for them to address first. And again, the comprehensive plan, when you look at the entire community, and we have pockets, obviously, commercial, residential, office space, how the pedestrians flow, traffic, everything that's included in a comprehensive plan. This is the one that we believe has, again, from the staff perspective, the highest priority, but it also has the most unique component of it. As I mentioned during our budget sessions, we are 70% residential. And so the comprehensive plan, as it looks at residential development, that isn't going to be as heavy of a lift as the downtown corridor. So we want to put our emphasis at the beginning on that downtown corridor because, as Aaron mentioned, we have people investing in there now. And it almost becomes a chicken and the egg situation. You develop a plan and then hope people will come and invest in your plan. Or do you have people who say, I think there's an opportunity here and I want to be on the ground floor of that discussion and I'm going to invest in those properties. And our job and the job of the consultant will to mesh that desire to having people who are making investments now, are easily identifiable in this process to say, you can go to person X or Y because they've recently purchased. We need to find out how we can make them successful and how this will blend together. So kind of in answering both of your questions is that this is going to be the highest priority coming out of the selection process.
The only thing I'd just add is, and then Aaron, you and Curtis have done a great job engaging with the development community too, but you've got some quality folks that are doing projects in this area between TWG, Merle Hay Mall, you've got Jeff Stanbro doing stuff, and I just think getting them involved on the very front end, because they're going to tell you what their concerns and objectives are, and then you can try and tailor what you're trying to do around that, including what we're trying to do in the comp plan and trying to address some of those things up front, because if we can make it attractive, we've got great momentum, but just addressing some of their concerns, so they're going to bring tenants with them, so.
Do we know what, I guess this kind of follows up what Adam is saying, do we know what Stanborough and the other folks are wanting to do when they're acquiring the property, and do we have enough vision to know if what they want to do is in alignment with what we want to see?
We don't know what we want to see quite yet. But I have hinted at what we're kind of using as a barometer as to
Right.
the types of development that they are interested in seeing. So it's,
So you're hearing that from Stanborough, that they would be interested in more pedestrian-friendly development?
yes, not
Because
a,
my fear would be that they're, and I say they very generically, as I just, mentioned Stanborough, but that people are acquiring these to do just your average strip mall or something, where we want a higher standard in this part of our community. And we probably need our plan to be able to say that, so.
right, we're in that limbo time where we think we know, but there's nothing really on the books so that we can, everyone can, count on it. The risk reward thing is, we'd like it to get more certain so that the folks can price it accordingly, to use real estate terms. So, but yes, the intended development, through assemblages is to do more with less, so that it creates more synergies throughout the corridor and between buildings to do that. The prices that some of these are transacting, there is some price that in there that folks are expecting to be able to have more to lease at the end of the day, rather than buying it, just doing some improvements and have it be an income-producing property. That's not what's happening with these recent transactions. So folks are betting for a better day and to be able to build more on those parcels.
I would also add that during our conversations that we had initially with Mr. Stanborough and others, is that they're wanting to do something in the sense of making the area better, giving back to the community. That was a theme that we had in those conversations, and that they were open, that they didn't have a preconceived notion that I want to put this here, is that they even asked the questions, well, what do you think, city? What do you think will work? And there we spent a number of conversations with, not sure what I want to do, but I want to do something that will be successful and that the city can partner with.
In my discussions with folks too, I think that's consistent, that they're open to it. They know that as Aaron says, there are better days coming, and we don't know exactly what form that's gonna be, but I think everybody has a general idea on it, and we can all work together to try to find that better day for that area, so. All right.
We will be back with you. We had
Oh, yeah,
some
this
time
is-
issues,
yeah,
yes.
yeah.
This is the teaser, if
Yeah.
you will.
I have one question that ties the Merle Hay and everything. We talked about what the Bucks want to do with their old arena. Has there been any further discussion that we can talk about?
There has been further discussion, but nothing we can speak about.
Okay.
Thank you, Aaron.
Yeah. Yes, yeah, we're all wanting a soft landings for the parcel they go and the parcel that they're leaving, so.
Okay.
Yep.
Thank you, Aaron, appreciate it.
Yep, thank you for the time.
Good update. All right, as we are past our hour, I'll just ask if there's anything additional for the good of the order. If not, I'll ask for a motion and a second to adjourn.
Move to adjourn.
Second. All in favor?
Aye.
Any opposed? We are adjourned. Thank you, everyone. Have a good day. So.
Thanks for using WebEx. Visit our website at